and young pharmacists all over Asia Pacific. So we are aiming to promote the role of young pharmacists in the region and prepare them to contribute significantly in their respected country and in the region. In this case, we want to contribute the health system in our countries as young pharmacists. So our members now has increased. So we have Indonesia, Taiwan, Malaysia, Philippines, Japan, South Korea, Singapore, Hong Kong, Cambodia, and Thailand. And we hope to have many other countries also joining us very soon. And after some of our countries, some speakers share, we'll also hear some more countries to give the update situations, and we can learn more from other countries as well. Next. Next, please. So before we start, I would like to remind everybody what is COVID-19 that we are going to discuss. So it's an acute respiratory disease caused by a virus called SARS-CoV-2. It began in the end of 2019. That's why which is called 19. And the disease began in China, but it has spread to more than 160 countries. As of today, we have confirmed cases more than 220,000, and with the deaths more than 9,000 deaths. So we know a few days ago, the WHO has declared pandemic. So now it's affecting everybody. Many countries, including our region, is one of the worst hit by the pandemic. So why we have this forum? Because we need to fight this COVID-19 as one, not only country by country, but we need to fight together, especially us in our region in Asia Pacific. Next. So as informed by FIP, the International Pharmaceutical Federations, there are role of pharmacists in combating this coronavirus outbreak. So I would like to remind everybody, so we know where we're going. There are important roles that we have to take as community pharmacists and also as hospital pharmacists. Of course, pharmacists in other areas are also important, including in the regulatory, including in the industrial section as well. But again, community and hospital pharmacists are also playing very significant role. As we see here, according to the FIP Health Advisory, community pharmacists need to store appropriate stocks of pharmaceutical products, which is not only for the COVID-19, but also for other illness as well. We also need to inform and educate the public, do the counseling, reviewing, promoting for disease prevention and infection control. And as hospital pharmacists, we need also to manage the stocks, and of course collaborate with other healthcare professionals, do the in-hospital prevention and infection control, informing and counseling, and of course we need to make sure the responsible use of pharmaceutical products supplied during this outbreak. Next. Not only FIP, FAPA has also issued a guideline for the community pharmacists, a document that is very important, and FAPA encourage us to take action and strengthening countries' existing health system by alleviating the fear and reducing panic through public health education, preventing the spread of infection in the community and in the workforce, providing direction for patients to access the health care services that they need, ensuring availability of essential medicines and supply by preventing panic buying and rational use of medicine. And this will be discussed further by one of our speakers, Jack, who is also a member of FAPA Bureau. Okay. Next. So with all the FIP and FAPA, and as us young pharmacists in our region in Asia Pacific, we want to make sure that we can learn from each other. That's why we have the online forum, so we can update our country situations and also learn from the success and failure of each country. So we can build a stronger system in the regions and we can combat the disease. So in the end, we will come up with recommendation and statement from young pharmacists. And of course, I hope that to see your active participations in the discussion after our speakers and the representative from our members countries. So then together, I believe that we can fight this COVID-19. Thank you very much, Kimi. You may continue with the next speaker.
Thank you, Audrey, for the very nice introduction. So Yeah, from Audrey mentioned that we are now like in the situation of pandemic and we all need to fight this together. So our first speaker from Malaysia, let's welcome Jack to share us the situation and also some of the experience sharing that Jack has prepared.
Hi, good evening, everyone.
Yeah.
Can you guys hear me? Okay. Okay,
Yeah.
so next slide, please. Okay, so greetings from Malaysia. We have the unfortunate distinction of being the fastest growing situation in Southeast Asia. WHO report 57 that was done yesterday shows that there are 8 new countries, and globally now that number is already 220,000. So every day the number is increasing very fast. Although the focus is there in Europe, we are actually concerned on a few areas that are escalating very quickly as well, namely Malaysia. We are growing very fast, and our bigger concern is also Philippines and Indonesia as well. Next slide. So now talking about Malaysia itself, this was information from yesterday. It's now been outdated. We are currently confirmed 900 cases, but the good news is we still only have 2 casualties so far, and they are testing as many people as possible by using contact tracing at this moment. There's no general testing as we are seeing in South Korea at the moment. Next slide. The reason why the Malaysian number suddenly just shot up was because generally of two major clusters. The first one is when our first major cluster came in was actually a high-ranking corporate officer, okay, and that actually contributed about 100 cases in the first wave. The second wave was actually because of a cluster in Sri Petaling, a tablet, which is actually a gathering in a mosque, a religious gathering, and attended by 15,000 people. And at this moment, they are trying to trace many of these. I think they managed to trace about 11,000. And from this cluster, we are now having 513 cases alone. So that this actually shows the importance of measures to be put into place to prevent mass gathering, because all we need is 1 or 2 mass gatherings, and then our numbers suddenly shoot up. A week ago, we were at about 100 over cases. Now we are at 900. Next slide. So because of the situation, next slide, please. The government has already imposed some measures to be put in place. Namely, the first one is a movement control order. We have actually closed our border to all foreigners. We have closed the border for all Malaysians leaving for the 2 weeks, 18th to 31st of March. And the main purpose is this to flatten the curve. Our latest speakers will actually explain more about how flattening the curve is important. So the main thing now at the moment is we have banned all gatherings and closed all schools, closed all higher education as well as religious services. And government has essentially, and private sector has also been shut down. Offices are closed. We are actually advised to stay at home. Our Prime Minister came on TV yesterday and told us to stay at home at least 7 times. Unfortunately, there are still people that are not staying at home. And this is something that needs to be done. It's a tall order to actually get so many people to stay at home, but we need to actually put it into place. If not, the number of cases will just grow. Okay, so next, this is the overall situation in Malaysia now. So now I move on to my role as Vice President of FAPA from the FAPA Bureau. FAPA has issued a guidance document meticulously prepared by our Secretariat and also our President-elect, Dr. Yolanda Robles, based in the Philippines. They came together and put together a document for FAPA's Bureau's consideration, and it actually states what a pharmacist needs to do. I'm focusing on community pharmacies because most hospital pharmacies actually will follow their hospital protocols with regards to this COVID-19 situation. So there is a greater need at the community level to let community pharmacies which a lot of them are independent or have their own protocols to actually come together to actually put protocols in place. So this document, right, the first thing is staying safe. The objective, as Audrey mentioned earlier, is to alleviate fear and reducing panic, to prevent the spread of infection, providing direction to patients, and ensure the availability of essential medicines. Next slide. How do we do that? Is number one is we need to prepare your team. Every community pharmacy needs to prepare their teams, okay, to actually be more aware of the situation. They need to be stay informed. In Malaysia now, we are actually announcing the numbers of COVID infected by state. That is something that needs to be aware of. So at least you know you're situationally aware whether the area around you have a lot of cases. We need to prepare staff for emergency situations. What happens? The question is, what happens if someone with COVID comes in coughing? What needs to be done by the staff? Of course, we need to establish relationship with key health partners, your local GP or doctors, as well as government officers as well. And the contact list is important. In Malaysia, we actually have a centralized critical contact list that is done. In fact, the government also has started a Telegram page for the National Security Council, where updates are put on there. And as a pharmacist, you also need to make daily updates and checks with your team. We can't expect everyone on your team to actually understand the situation as much as the pharmacist. So it's good that you can get the information online or from the sites by the Ministries of Health to actually share with your team. And this is how we can do to protect our staff. And the other thing we also have to mention is we need to manage patient expectations, especially with regard to testing as well. There are a host of testing that are coming up as well now, but our gold standard is actually still to refer them to the hospitals, the designated locations where they can actually get the proper test. Next slide. Okay, so then now that you are starting to look at your team preparation, you also have to prepare your location, whether for infection prevention. I think some pharmacies, actually a lot of pharmacies in Singapore have done this very well. Maybe we can share a bit about it later. First thing first is you check your staff temperature every day. You make sure that the people around you are healthy. They don't have fever. And there is a need to actually screen patients when they enter. A lot of pharmacies are open, so that is a problem. We need to practice social distancing as well as actually promote hand hygiene. Make sure that there's water in your pharmacy. You can wash your hands and all that, and disinfect services regularly, and the usual hygiene must be put in place. And of course, you have to ensure proper use of protective equipment. Make sure that the staff is wearing your mask properly. So I will give you an example of next slide. Our community pharmacy have taken action in Malaysia. Okay, this is actually from our Northern Penang Area Committee Chair, Ms. Gina. She sent it to us. So this is actually an independent community pharmacy, and you can see the first picture. They actually put lines on the floor. That is where a patient is supposed to stand. They are about 1 meter apart, so that is actually a social distancing effect. And in the second picture, you can see at a dispensary area, they actually put an X box there to prevent people from standing. So there are actually two lines in the sense where they can go. And of course, in order to make sure that in a small space this works, you have one in and one out. The last two pictures shows that. This is one example. Another example is another pharmacy that I know, located 40 minutes away from Kuala Lumpur in the south. What he did was, because he doesn't have the space, he just barricaded his entire pharmacy. So he allows a small area in front for patients to line up, and where all the other stock and everything is placed behind the barricade, so that they request and the staff will pick for the patient. So there is a gap to make sure that there is distance in place. So that's an example of a community pharmacy that measures are being taken. Next slide. Okay, so FAPA also, FAPA's document also addressed another issue that we need to look at that no one actually is starting to look at yet. Australia has started doing it, is that we may have an impending issue to consider. Pharmaceutical supply is a very big issue. The issue of API shortage because of production, lack of production in China, and so on and so forth. So this is something that I encourage all pharmacists to actually start looking at a list of alternative suppliers, maybe even limit dispensing, like what Australia is doing. The Pharmaceutical Society of Australia has recommended the limit to dispensing. So it actually prevents hoarding. Yeah, next slide. Okay, so basically what I presented just now is based on a viewpoint from FAPA and what are the guidance document that needs to be done. So after this document is released, as well at the same time that we have been discussing it, the Malaysian Pharmacy Society, MPS, that's the society, the Malaysian Society for all the Malaysian pharmacists, actually put a series of points into place, and this has been relayed to the government as well as to the media. So one important thing is that to know is that your professional society can help and they can play a major role. Please connect with them to actually get this done. How can community pharmacists help with COVID-19? We actually list out what a community pharmacy can do. Okay, this can be from providing information, referring cases. So there is a conscious need that the pharmacist must remember not to treat symptomatically. Okay, one of the problems that we always have is that we like to treat our patients. We give them Panadol and cough suppressant. No, we don't do that. In this case, if they have fever and cough, please refer them to a designated medical facility. We need to actually manage our stocks better. We have to store appropriate stocks. One of the problems Malaysia is having now is that we actually have no mask at all to be found in the private sector. So that's something that we are doing. The MPS is also trying to source it to actually help assist community pharmacies to get stocks. Next slide. Okay, we also need to start looking at availability of essential medicines. This has been raised by the society to the government. And so it's something that it can actually be done at the store level, at the community level as well, is that because you know your patients best. So there might be, and you know who are your regulars. So there is a need to actually look into that and see whether you can actually see how long you have enough supply for them as well. And education is important. One of the problems in Malaysia now is that every day we get fake news from some very ridiculous, some very believable. So I think as a pharmacist, we need to dispense the right information as well to all our patients where it comes in. Next slide. Yeah. So at the same time, we also presented a list of requirements and needs to the government as well. Like for example, we need to have clearer methodology to refer patients to designated healthcare facilities. That's one. The overcoming supply problem is the big problem here. We actually have people hoarding already, and there's something that we need to actually sort that out very quickly. And one of the issues we have is that until recently, we are still allowing our masks to be exported. That is something that we need to do that. Next slide. Yes, so we need to actually stop hoarding and profiteering. I think it was in Denmark that was shared in the world news today was that it was really smart. They said one bottle $40, next bottle 1,000 kroner. That is actually an interesting way to do it. And we have to work with clinics. We are not alone in this. That's why when the Malaysian Pharmacy Society reached out to the government, we went together in the healthcare coalition with the doctors as well, because it is actually a unified fight that requires input from all health professionals. Yeah. Next slide. Yes. The other one that we mentioned to the government is actually to designate pharmacies as a point of contact for the healthcare system. At the moment, most of the time it is still referring to clinics as well. But because right now the numbers are increasing, we need to actually get this sorted out. And we also need information from KKM, is our Ministry of Health, to actually disseminate the information to all our patients. Yeah, so that's more or less my presentation, my sharing. The next slide. Yes, I have one more slide, which I always like to end. It's actually a quote from Winston Churchill. Yeah, so that's it. Courage is rightly esteemed the field of human quality. So have courage, everyone. We can fight this together. Thank you very much. Back to you, Kimmy.
Thank you so much, Jack. It's very useful information for everyone, I think. And I can see in the chat box is where everyone sharing the situation from your countries. And then but don't forget to put your question into the Slido. Amy, can we send the link again for them to remind them to go to us in the Slido? Yeah. So the next speaker will be Heyman from Taiwan. So Heyman, are you ready?
Yes.
Okay, let's start.
Yeah. Can you hear me? Okay.
Yeah.
Hello, everyone. I'm Heyman from Taiwan, and I'm stand for the president of Taiwan Young Pharmacists Group. And okay, save our time. Just go on. And this next, sorry. This is the all night today, and I would like to talk a little bit about the public health and how the government, Taiwanese government, do for these several months, and what can the community pharmacists and pharmacists do in their neighborhood. And as we are a young pharmacist group, we are non-governmental organizations. So what can we do, and what we already done? And the other hand, the pharmaceutical company and industrial challenge will going on. So what will be the challenge next? Thank you. Next. Okay, so the definition of public health is the science and art of preventing disease. So it is not only the medical services. It is also about the political and diplomacy and economics. So I think when we are talking about the public health, we should see overview of the situation of the society. Next, give me next. Okay, thank you. Why Taiwan is so alert of the rising epidemics. Um, when we back to the history of Taiwanese medical history, and we can see in 2003, the SARS affect the world, and also Taiwan, we have more than 300 cases and 70 deaths at that time. So after that, the Taiwanese government is established public health response mechanism about the National Health Command Center is a part. So because Taiwan is so close to China, and also we have a lot of economic activity with China, and more than 400,000 workers in China. So we are very alert about this epidemics begin. Next. Give me next. Okay. So I will share the timeline. What did the Taiwanese government do when the disease outbreak? In the end of 2019, when we noticed some new pneumonia outbreak in Wuhan, and the Chinese government start to have the officials aboard on direct flight, which is 12 flights every day from Wuhan, and inspect the passengers for fever and pneumonia symptom. And at January 21st, Taiwanese government started the NHCC to coordinate efforts of Ministry of Health and Welfare and Transportation, Economics, Labor, Education, and Environment Protection. And at January 24th, Taiwan restrict the medical mask usage, and 20th, the first native case without Wuhan travel history, which is a family effects from a confirmed case happened in Taiwan. And the 4th of February, the because Wuhan is already shut down at that time, so the government has a charter flight back to Taiwan from Wuhan. And the 5th of February, the Taiwanese government banned on the Chinese tourism. That means all the provinces, not only Wuhan, from entering Taiwan. Next. Next, sorry. Okay. Uh, at the 6th of February, we starting the real name system to sell the medical masks in community pharmacies. This is the first time of history in Taiwan. The community pharmacy has a lot of media export, and the government used the national health insurance system to control the selling of medical masks because we are affording by from the medical mask shortage. And the 9th of February, the cruise ship of there are 128 passengers on the ship, and they come back to Taiwan, and the Taiwanese government tests within 1 day, and all the passengers are negative. At 16th of February, the first death is reported in Taiwan, and NHI, also the NHI database is banned to cover 30-day travel history. So the medical institution can check by the NHI system that all the patient who has several symptoms, that we can check the travel history on the national health in the system. And when the time goes to February 29th, they have 5 new cases are confirmed in 1 day. It is the first time, the first outbreak of nosocomial infection, and is unknown source of infection. And the second day of March, an Australian musician leave Taiwan on that day and is diagnosed upon arrival in Australia. At the 9th of March, the one Taiwanese case is confirmed in the Philippines. The case is who is contact with the case number 44 in Taiwan before. And the 12th of March, WHO finally announced COVID-19 outbreak is a pandemic. Next. So let me have some remarks of Taiwanese strategies. First, Taiwanese government provide infectious disease consultation line for the public. So everyone can dial 1922 in Taiwan when they have any problem of communication disease. And also, as I mentioned, the Taiwanese government opened a national health command center to unify all the resources and increase the efficacy. And so the NHCC not only provide the resources, and they also have announcement at the daily press conference, and they also evaluate the travel warning every day. So the government increased the production capacity of medical masks and control the selling. It is because the import demand is far larger than export demand in Taiwan. Most of the medical masks is import by from China, so it will be not enough of medical masks in Taiwan. So the government decide to ban the export, and also increase the production capacity. And the government also implement the home quarantine and isolation. And hospital start to implement the patient flow manage. The acute patient will depart from the chronic patient in hospital, and the the research institution start to accreditate remdesivir API development, and also the FDA in Taiwan start to coordinate medication inventory and shortage prevention. And the CDC in Taiwan conduct the outbreak investigation uh, as long as every case is confirmed. So next. Okay. Uh, so far, the Taiwanese strategies is to keep the number affordable. You can see this figure. Um, if the so every country have their health system capacity. If the capacity is more over than the patients is more over than the capacity, the health system will be shut down. So Taiwanese government is trying to control under the capacity. So we have some strategy which is protective measurement. So with the protective measures, the cases we will trying to lower the patient number under the capacity, so we can control all the situations. So nowadays the latest number of Taiwan, we are 108 patients are confirmed, and one is dead, and the government already test more than 20,000 citizens and exclude 18,000. Okay, so there is, but the disease still outbreaking, so we can see the figure here, and the green is suspected, and yellow is a report from the home isolation, and the blue one is a report of confirmed COVID-19. Next. Okay, so what is the role of community pharmacy in public health? We can show an example from Taiwan to control the medical mess. As I mentioned, is the medical mess might be not enough in Taiwan, so the government start to collect the resources, and they built up 60 additional surgery mask machine line, and trying to increase the mass production to 10 million a day. And the IT department design a pharmacy mass map, so they can the citizen can see the real time number on the map, and they can select where to buy their medical mask. So this is the real time and real name system is rely on the national health insurance system. We use the NHI card, and we go to the community pharmacy to buy the medical mask. We can buy it for 3 masks every 7 days. It used to be 2 masks every 7 days, but increased to 3 masks every 7 days. And the most important is the price control in 5 NT dollar a piece. It is the US dollar for 0.17. And next, sorry. And also the community pharmacy promotes the citizen to get the prescription medicine refill in community pharmacy. Also, Taiwan Young Pharmacist Group, when we have chance to the media, and we start to promote to the citizen to get their medicine in community pharmacy. And also we have the effect box or for the Facebook profile picture you can see on the top. So we start this awareness. Next. Because of a lot of community pharmacy is not enough of human source. So the TYPG start the volunteer project for community pharmacists. We ask for hospital pharmacists or pharmacy student who can be volunteer to help community pharmacy to deliver the medical meds. And we also collect the need from the community pharmacy. Next. Next. And we also have some poster created. The first one is to encourage people to leave the face mask to those who really need. And the second one is to promote washing hand more frequently and effectively. And the third one is TOCC form for community pharmacy. The TOCC is for travel history or and the occupation and content and the cluster that we create a TOCC form for community pharmacy before they sell in the medicine of like cough or fever, like acetaminophen or ibuprofen. I can see some question from the slide though, asking about how should we ban patient from uh, acetaminophen or NSAID. I think we should alert and to refer the patient to medical institution by this form. We can know the risk and manage the risk by the form who has travel history or who is at doing the high risk occupation and who has the contact history or cluster history. Next. Oh, sorry. Okay. And also we already delivered the medical meds for more than 1 month. And a lot of community pharmacists feel they are so tired. So we have this mental project for community pharmacists. We collaborate with online counseling platform and the counseling psychologists. And we provide this project for community pharmacists only and help to relieve the stress from the medical ration mission. Next. So we are pharmacists. We provide the medicine and also the medical devices. What will be the challenge next? In Taiwan, although more than 70% of medicine is made in Taiwan, but still there are 50% of medicine is from Europe and 2% is from United States. So when the disease outbreak in the world, so we might be faced of the shortage of medicine. So that we can prepare first for inventory the medicine and to see what we really need and what is we already to be shortage. Next. Next. And although there are more than 70% medicine is made in Taiwan, but actually when we looking back to the API, the resource actually is from India and China. So this is another challenge of public health that if medicine shortage come, when will it come, and what we should prepare first. Next. When I know I need to share some view and experience from Taiwan. I'm so nervous, but I think I need to share my reflection to you. So those are my reflection because Taiwan is so close to China and a lot of people are are panic at the first time. So I want to share my reflection that panic is more dangerous than pandemic. Um, you can see on the news a lot of people are they are crazy for shopping in the supermarket and the stock is already empty. But uh, we should stay rational and stay honest. So the honest is the best policy for me, and I think to report all the real data for to the world is the responsibility of the medical staff. And stay aware, stay rational, and be honest. Next. And this is all my presentation. Thank you. Thank you, Kimi.
All right, thank you, Heyman. And I believe that we has learned a lot from the Taiwan um, strategy and models that how they deal with the virus. And next we will have the next speaker from Hong Kong. So please welcome Edward.
Hello, everybody. Can you
Hi.
hear me? Yep.
Yeah.
Good. Thank you. So, yep, I'm based in Hong Kong, from the Pharmaceutical Society of Hong Kong. Yeah, Kimmy, thank you. So I'm just going to share the major strategies employed here in Hong Kong. So relatively, for Hong Kong, the situation, at the beginning we had a spike in confirmed cases, and then we sort of relatively managed it pretty well for the past couple of months. So I just wanted to share the 4 key public health strategies that we've used in Hong Kong. Next, please. So there is this is a government initiative, a website set up by the government where the public and the healthcare professionals, everyone can go there for a centralized place to access information about coronavirus. Next page, please. So there is a local disease dashboard. So this data, everyone can go there and take a look at what the current situation is. It's not that clear, but the first figure there is the confirmed cases. So this is from yesterday. Right now is I think it's 208 confirmed cases, 4 deaths. And each of the cases are tracked. So on the right, you can see each of the case, there's a case number, and whether the person is a resident, whether the person is hospitalized or recovered, and how they have contracted the disease. So whether it's an imported case, a local transmitted case, or from a close contact of an imported case. And in the middle, that's the map of Hong Kong. So you sort of have an idea where the spread is. And the next page, please. So if you click into the each of the case, you can see where they're located. So this is an example. So at least people can know whether there are confirmed cases around them. You wouldn't get the exact address, but at least the building would be identified. Next, please. Yeah, so the first strategy is containment, which is one of the very common strategy used in many places in the world. So right now, the situation is there is a world travel alert. So right now, there is an outbound travel alert on all overseas countries and territories. And people are advised to adjust their travel plans and basically just stay in Hong Kong unless absolutely necessary. So this was only been in place from the 19th, today, yeah, which is effective. So it's at the beginning there was a bit of a hesitation about whether we should close the border or not. Next page, please. Yeah, so there are a few more things that the government have done so far. The first one is health declaration. So from beginning of this month, the 8th of March, travelers coming to Hong Kong via the airport are required to submit a health declaration form. An online version is also available. And the restriction from entry into Hong Kong applies to all non-Hong Kong residents who have visited the Hubei province in China in the past 14 days upon arrival, and this was in place since January 27th. Next page, please. Next, please. Yep. Compulsory health quarantine measures. So they're in place for inbound travelers arriving from all countries and territories. I need to say that there are a couple of exclusions that's from mainland China and from Macau, except for the Hubei province in China. So people coming into Hong Kong are required to stay at home or a specific dwelling. And how they're tracked, at the beginning, there was a sort of like a wristband device used, and I think it was a local effort made by a local company. In the beginning, it wasn't so perfect because I think the device at the beginning used was the mobile phone, and if they unplug the mobile phone from their charging device, then the authority would know. But of course, there is a loophole. If you get out of the house without unplugging the phone, then theoretically people wouldn't know. So I think over the past weeks, the government is working with some new companies, technology companies, and developed some newer wristband devices to monitor the people who are in home quarantine. Next, please. Quarantine centers. So for the more higher risk people, for example, this is the exhaustive list actually. So in the certain places in Korea, from Iran, from these regions of Italy, and also Hong Kong residents returning from Hubei province. So in a couple of slides back, non-Hong Kong residents from Hubei are not allowed in at all. But Hong Kong residents returning from Hubei are allowed into Hong Kong, but they need to stay in the quarantine center for 14 days and monitored. Next, please. Yep. So the next key strategy used was contact tracing. So so every patient, they would be questioned, and information of their travel and social contact history would be analyzed. To identify all of their close contacts, so they could also be quarantined and monitored. At the same time, there is a system called a Major Incident Investigation Disaster Support System. This is actually, the system is owned by the Hong Kong Police. It's a supercomputer system that could also be used to trace the close contacts of coronavirus patients. This was used in 2003, when SARS was also a major issue in Hong Kong at that time. So this computer system could be used to analyze, which area of the city is high risk, and also there is a complete map of the close contacts of the patients. Next, please. So in terms of social distancing, I think this is one of the stronger points we have in Hong Kong because of a great community public effort. So schools have been closed since January until the end of April. This is also not confirmed yet. So it's, looking at the situation, this might need to be extended. Civil servants mostly work from home since Chinese New Year. And beginning of March, they progressively resumed office work. So this policy applied to civil servants, but then many companies have also followed suit. So mass gatherings, basically they're all cancelled in Hong Kong, including all sorts of conferences, banquets, and religious gatherings. Next, please. So yeah, so this is a poster, again, this is from the government, teaching people on how to prevent catching the virus in the workplace. For example, encouraging companies to allow flexible working hours, and also to check the body temperature before entering office buildings. I think a lot of places already have this measure, and basically to avoid having meetings where a lot of people are in a small room. And face masks, they are recommended when people do take public transport or are in places where they are quite crowded. Next, please. In the community, these are the points where the public are educated about social distancing, avoid shaking hands, stay in ventilated places, and not gathering and using, sharing chopsticks and spoons. Try to stay at home as much as possible. And I think, this, in terms of this social distancing, the people in Hong Kong are quite diligent in executing. And I rarely see people really going into mass gatherings these days. Next, please. Hygiene and personal protective equipment. So there are a lot of public health education. It's all over the place. Not only ones issued by the government, but also from universities, from medical experts, pharmacists, and doctors. So people are well educated in the correct way of washing their hands, cough etiquette, hygiene, toilet hygiene, and also the personal protective equipment are provided to to the frontline staff, healthcare professionals by the government. Although we did, it is still an issue where it is always possible that it would run out if there is a continued outbreak. So for private practice, including community pharmacies, basically healthcare professionals would need to purchase their own. And these photos are people lining up for face mask. So we don't see this right now. I think so. These photos are from a month ago. Back then, the situation is pretty bad. So right now, at this moment, I think people sort of the face mask issue is still a serious issue, but not as serious as other places in the world. Next, please. Yeah, so this is another piece of public education on disease prevention. So one of the learnings from SARS in 2003 is one of the first patients in Hong Kong that got contracted was due to the toilet, because of I think there was a neighbor, I think upstairs, who had SARS, and then they went to the toilet, and then because of the U traps in this mentioned in this poster has dried up, so the air, the dirty air, together with the virus, was able to go to another floor of the same building, and then that's how the first cases of SARS has spread in Hong Kong. So from that learning, everybody are advised to put in half a liter of water into all the U traps, basically the drains, all of the drains in your house, so that these water traps are always filled with water, enough to stop the dirty air from coming into your house. Yep, next please. Yeah, so this was taken from online. I think this was on one of the ft.com. Yeah, that's right. So Hong Kong, as you can see, the trajectory compared to many places, we're doing quite well. So basically, due to the reasons proposed here, we're due to school closures and quarantine measures and a strong community response, and I do agree with that. Although, I mean, this can change anytime because the situation is still quite volatile, and also because of the the new policies recently, just for the past couple of days, a lot of overseas students have come back so that they can avoid the mandatory quarantine measures. So we'll still the future 2 weeks is still quite a critical period. Next, please. Yeah, so this is my last slide. So overall, in terms of the strategies, this is a review. So the community response was tremendous. I think people are really listening to the advice from experts and the government. Social distancing was quite effective. The preventive use of face mask, this is one big thing, and spectacles protecting your eyes. So basically, if I go out, onto the street or anywhere in Hong Kong outside of my house, everyone, I would say, 99.9% of people would be wearing a face mask, and most people would have glasses. So this is preventive. And I do support that. I think that's very important. Hygiene practices, people do have a bit of a routine. If I come back from outside, before entering the house, I would take off my shoes outside my house, disinfect it with diluted Dettol, change my clothes after getting home, and also basically when I'm outside, I would wear either gloves or use a piece of tissue to avoid contact with any door handles or lift buttons. So the containment strategy is okay, but it's still needs to be reviewed. And the local medical expertise was excellent. Yeah, I think from all healthcare professionals, doctors, pharmacists, nurses, I think we all did very well as a team. The not so good things are a short supply of face masks, especially in January and February. I would say the face mask situation is a complete failure, especially when compared to places like Taiwan, where they, very quickly stopped the exports of face masks at the end of January. And one of the issues with the government was the government tried to procure face masks, but then after a couple of weeks, they said it wasn't successful. And that's not something the public would be expecting to hear. And when the government says something like that, everybody panics again. And so it's not helping the situation. So right now, the government has new strategies. I think they're subsidizing people who decide to build a face mask production line. So that the government would subsidize the production line, but that would still take a bit of time. Initial sorts of disinfectants. The initial hesitation in travel bans. So the travel policy had been controversial, and the healthcare sector had been quite vocal about it. So hopefully, the government would also, continue to listen to the people on this area. And the home quarantine policy may not be completely effective because there will always be some people who decides to just duck down to the supermarket to buy something. So that's, again, technology would help, and I'm glad to see new technology like wristbands and stuff have been used. So yeah, I mean, it's been a very good learning experience for all the pharmacists in Hong Kong, especially speaking for myself. So really hope that the platform here will continue to communicate and share the knowledge we have in different countries. So yeah, thank you very much.
Thank, thank you, thank you, Edward. And now we have already done all the session sharing from all the speaker. Thank you, Jack. Thank you, Helen and Edward, that sharing us the situation and experience from Malaysia, Taiwan, and Hong Kong. And I believe that we still have some participants from other countries here. So first of all, we would like to invite Singapore for comment. Um,
Hi.
we have Sandy. Yeah.
Hi, everyone. I've been asked to, Frankie here from Singapore. I've been asked to share about my personal observations on how in Singapore we have been facing the COVID-19 situations. So I think I will just to make it into more of a general comment first, and then perhaps later on I will follow up with some practical advice for the pharmacists here. So as a pharmacist in Singapore, I think what I gather here first and foremost is that we need to plan ahead. We need to be prepared for the worst. Start if you haven't start to draft your business continuity plan. Start now. It should include detailed actions that will be taken in the matters of days because things are changing rapidly in a way that not known to us before. And secondly, we need to stay calm. As a pharmacist, we should be model citizens who help in alleviating public fears and concerns. Um, just some personal opinion, personal advice to pharmacists, all pharmacists here, that this is the time for us. First of all, this is the time for us that we should apply our training, our years of experience. We should apply evidence-based practice to provide most accurate information to the public and direct our clinical practice. Secondly, with those in the hospital, be prepared to provide any clinical guidelines for treatments of COVID-19. There are some medications who are undergoing clinical trials. So prepare guideline on those based on the approved drug in your countries and all the available guidelines. And regarding to the supply chain of pharmaceutical drugs, I would say we need to consider the collateral damage of the panic buying. For example, uh, alcohol swaps for patients on point of care treatment, glucose point of care treatment, or subcutaneous injection. Please be prepared to make sure that you have enough alcohol swab for those patients, and also those medications that are being used for clinical trial for pharmaceutical treatment of COVID-19, for example, Kaletra for HIV patients, chloroquine for malaria. So maybe perhaps you can consider to segregate stocks to ensure no patients suffer from unintentional impacts of supply chain crisis. I will also make a suggestions to your pharmaceutical or medical associations to combat all the misinformation and hoaxes spreading among the public. For example, recently there is some hoaxes, misinformation saying that patients who are on ACE inhibitor or ARBs are on higher risk of getting infection to COVID. So you can use your knowledge, evidence-based practice to combat all this misinformation. But however, please remember to align yourself with the government direction to prevent any public mistrust towards the government. And also, you can consider also to create interest group, chat group among the pharmacists for information sharing. Consider to make a special group for pharmacists who have interest in infectious disease, epidemiology, or infection control. That will be useful in the days to come. So stay safe, everyone. Yeah, I'll just pass back to Kimi.
Thank you, Frankie. Such a great sharing from Singapore. And next, we would like to have um, the representative from South Korea. Can we have Sally to speak?
To share about the current situation in Korea, Korea has over 8,500 tested positive patients of coronavirus as of today. Given the surging spread, the government of South Korea raised the alert level to the highest red on February. So until the end of January, the alert level was orange because until then, Korea had only 30 tested positive patients nationally, and the situation seemed to get better then. But just 10 days later, a woman called as case 31 tested positive, and she had attended services at the Shincheonji mega church in Daegu area, which is like a pseudo religion in Korea. So From then, Korea identified more than 3,000 new cases just in the next 12 days, and most of them were Shincheonji members. So on 29th of February alone, KCDC reported more than 900 new cases in a day, um, and making the outbreak the largest outside mainland China. So we are taking some measures to alleviate this situation. KCDC have made plans to secure medical personnel where needed, especially in the Daegu, Gyeongbuk area, where the outbreak was the most severe. And the KCDC also regularly distributes press release data, and they open regular briefing sessions twice every day to deal with this situation. And they also run a 24-hour call center for suspected patients and figure out ways to clarify the contact tracing. So we have banned entry from Hubei in early February and applied special entry processes to some of the countries. And Korea's situation appears to have greatly slowed. It reported only 74 new cases today, compared to 900 at its peak on February. So far, the success has been due to the well-organized testing program, combined with extensive efforts to isolate infected people and trace their contacts. So South Korea has tested more than 270,000 people. We have mobile diagnostic center and drive-through diagnostic center to test effectively. We have experienced during MERS, which was a previous large outbreak, that lab testing is essential to control the infectious diseases. So after the coronavirus emerged in China, Korea CDC developed the test and cooperated with the diagnostic manufacturers to develop commercial test kits. And the first test was approved in 7 February when the country had just a few cases, and they were distributed to regional health centers. So for contact tracing, we have some legislation enacted to give the government authority to collect mobile phone, credit card, and other data from those who test positive to see where they were recently and those information without the personal identifiers is shared on social media to allow others to determine whether they may have crossed paths with an infected person. So high-risk patients with underlying illnesses are the top priority for hospitalization, and those with moderate symptoms are sent to other facilities provided by public institutions to get medical support and observation. And those who recover and test negative twice are released. We are advised to wear a mask, wash hands, avoid crowds and meetings, work remotely. So I am also currently working remotely, and join online religious services instead of going to churches. And school days have been delayed to 6th of April by 1 month period. And yeah. So the number of new cases has dropped by past 2 weeks, but we are still not sure if this is slowing down, because there are still new clusters appearing. So we have to make sure that this situation gets better. And to prevent community infection, people started to buy a lot of medical masks, and convenience stores and pharmacies are running out of masks. So to solve this issue, the government have launched the 5-day rotation system to purchase the masks. So under the new implementation of the 5-day rotation system, face masks can be purchased based on the person's birth year. So the person has to give their personal ID and the day for purchasing the face masks can be determined by the year of birth. For example, if someone's birth year ends with 5 or 0, they can buy face masks on Fridays. So the government has limited the number of masks that people can purchase per week to 2. So they can only buy 2 masks per person, and they still have to identify themselves with their personal ID. This the South Korean government released the mask sales data in the pharmacies to the public by providing it as an open API. So the developers are creating apps, applications that notify people about the inventory status of pharmacies nationwide, so people would know where to buy masks. And pharmacists are doing their best to make this system work smoothly, although it is a high burden for them as well. So this is it about it from South Korea.
Thank you, Sally. All right, so we have the next coming, the representative from Philippines. Can we have she from Philippines to speak?
Hi everyone, this is She from YPG Philippines. Can you hear me?
Yeah.
Okay, great. First of all, thank you to AYPG for organizing this. This is a very good learning, I guess, very good learning experience for everyone in the call. We have heard several best practices from different countries, and I think we could really have a good use of a consolidated document of these practices so that we can also see what we can adapt and implement in our own country. Especially, as you know, going now to my update, we have a fast increasing number of cases in the Philippines. Both cases and person under investigation are increasing. So just recently, after the community quarantine that was imposed for the capital region of the Philippines, after a day or two, an enhanced community quarantine was imposed for the whole group of island of Luzon, which is the largest group of island in the Philippines. So enhanced community quarantine means um, lockdown already. And other local government units in other groups of islands have followed suit, depending on the situation in their areas. So since the number is increasing at a rate where um, our health facilities could not accommodate if not controlled, our Department of Health has imposed protocols in terms of having ourselves checked when exposed to anyone who is suspected or is confirmed to have COVID-19. So these protocols is for us to be able to assess ourselves, and we are advised not to rush to the hospital to have us tested, because as I said earlier, the facilities would not be able to accommodate us, and there is a high risk of also contracting infection if we do so. So if there is no symptoms, we are advised to do self-quarantine so as not to infect other people if the infection would develop after a few days. If we are symptomatic and if these are minor, then we are advised to just call the hotline of the Department of Health or call our doctor to get advice on what to do for the next steps. And I'm also happy to, although the situation is still being tried to control, I'm happy to also update that there is locally developed testing kits here in the Philippines that was approved swiftly by the FDA. And also there's a guideline on e-prescription, especially for those who are vulnerable to contracting the infection, so as to facilitate dispensing of medicines to these vulnerable population. And lastly, for the updates, there are a lot, but I would like to. I'm conscious of the time. Um, the Philippine Pharmacists Association formed a team, a pharmacy response team, across different groups of or areas of pharmacy, so as to develop tools and information drive that could help our frontliners, especially those in the community practice. So now it is being mobilized, and the Young Pharmacist Group is helping, doing its part to do the information drive, given its reach and network. So that's it for Philippines.
Uh, Thank you for sharing. So next will be the discussion, but I think we really short of time now, so maybe we will take like 5 to 10 minutes for the discussion. Um, I will ask the top question first from the Slido. So there is a question regarding the ibuprofen that there is a country suggest to avoid the ibuprofen to the COVID-19 patients. So how, and also the WHO has agreed with this, and what would be the right approach? Any comments from the speakers or any participants you want to share this? You can raise your hand, so I will unmute your mic. Audrey, please.
Hello, everyone. Thank you for the question, Kevin. Yes, this is very important issue about ibuprofen. I just want to go back to all other viruses, especially one of that is SARS. We also have records that ibuprofen and SH, and also, especially ibuprofen and also corticosteroids are not good in treating coronavirus. So taking from there, and as we see the result from France, and also not only France, there's also some other countries showing the result that also Italy, showing the result that those who are taking ibuprofen is more likely to be um, more more likely to have severe cases. Well, even though the data is not have enough evidence according to WHO or EMA, still, if it's possible, it is better for us to avoid using ibuprofen. So we can take other products such as Panadol, such as paracetamol. In any case that is that the temperature is very high and needed ibuprofen, it's only on certain cases. So if it's possible, um, try to avoid ibuprofen as much as possible. So that will be the best. And also just do the check of the temperature regularly, and also try to with the infusion, it's also will reduce the temperature as well. Thank you.
Thank you, Audrey. And also there is the question regarding the third line drug to stop the symptom from the COVID-19 infected. I personally believe that there is some medication that under the and some in each country use um, the different treatment somehow. So maybe each of the speaker can you share the medication from your countries, how they treat the patients. Okay, we go with Frankie.
Hi. I think for these questions, right, I would suggest instead of giving, I would suggest instead of getting, it's there have been a lot of guidelines circulating around, and I believe also your respective countries should have already produced the guidelines. If they have not, then perhaps they can look online. There's quite a number of different guidelines. There are also to take note that we have mentioned earlier. There is a lot of clinical trials as well that's going on. Um, please be cautious. Please be cautious, and also remember that, I mean, like as mentioned by Jack earlier, that if, for example, if you're a community pharmacist, it's better for you to refer the patient to the GPs, refer the patients according to the guidelines, according to the instruction that have been given to the government. Um, if you have not have any, for example, if your country have not have any guidelines on for the pharmacists, community pharmacists on how to handle this, perhaps it's time for you to maybe ask the pharmacy associations, or refer to the FAPA guidelines on what is the proper measures that we can take. I think there are different medication in different countries. It'd be important for us to really um, learn and study the background behind side effects and stuff for each particular medication. Use your evidence-based medicine. Don't panic. Stay calm, and yeah, stay true to your profession. That's I think that's the best advice that I can give.
Thank you, Frankie. Any other speakers would like to share about the medication? And Sally has shared what they treat in Korea in the chat if you want to share. Audrey, you can speak.
Okay. Thank you. Thank you. I just would like to emphasize on what Frankie has said, that different countries have different medication. So including talking about the first line, the guidelines, there is no guidelines that can be used globally. So every country has their different guidelines. Even for, like, for example, Indonesia, we haven't had the final guideline on how to treat the disease. But again, what is very important is to update with the situation, because the clinical trials is ongoing. So new results are coming. We know that chloroquine, hydroxychloroquine, are useful, and then we also know that the favipiravir is also useful, and remdesivir is under clinical trial. So we just have to um, learn as much as we can, because this is a new virus. There are also new treatments. We need to learn new things every day. There are always new things coming. And then the other thing is, the most importantly, is the availability of the product. So comparing, like, for example, Taiwan and Indonesia, and then comparing to South Korea, most probably there will be different treatments, because some product, for example, that Heyman mentioned, that they are that Taiwan is using remdesivir. In Indonesia, it's not possible, because remdesivir is not available in Indonesia. So that is what is important for us to know. And again, we have to go back to our government. What is their recommendation? Thank you.
All right, thank you, Audrey. We got a question from the floor. Let me check. Any other speaker would like to share? I think no more. So, Cynthia, can you can have the floor for the questions.
Hello, thank you for the chance that
Yes, we can hear you now.
yeah. I'm a pharmacist from a private hospital as a head of department. I want to ask how to dispense the medicine to isolation ward, because my hospital has the referral to COVID, and how I can ensure my staff pharmacists should be safe, uh, can save, because they will deliver the medicine to the isolation ward. And my second question, my hospital is on mask shortage, and we produce the DIY masks by the spoon pound. It is water repellent, but we have no the filter for the bacteria, no filter the bacteria layers. So I can assure the mask effectiveness, but I need to send the marks for the frontliners as a doctor and nurses. Is it okay or not? Thank you. Thank you.
Thank you for the questions. Anyone has input regarding the two questions? Please raise your hand. But I think it is for the max is the same problem in every country, that we are shortage of the effectiveness for the frontliner, even in the hospital. Anyone would like to share some strategy from your countries? Christine, you may have the floor.
Okay. Um, the recommendation that we found for frontliners, especially pharmacists, is only for droplet precaution. So we just need the protection against the large droplets produced from the mouth and the nose. So one alternative, especially when there is no mask available, is to use the face shield. So the face shield can protect against any unwanted splashes when you're talking with patients in the front line. Um, there are some new information about the virus being airborne, but this is only applicable for settings where they perform intubation or use nebulizers. So in general, for the Philippines, what we recommended is to use the face shield, the clear plastic or acrylic face shield. Thank you.
Thank you. Any more input or questions? You can raise your hand so I can call you. I think this will be the last question. I saw one. And Stanley, you may have the floor.
Hello, hello. Hello, can everyone hear me?
Hi. Yeah.
Hello.
You can introduce yourself a bit.
Okay, so hello, my name is Stanley and I'm from Asia, and I hope this question is related to the topic. I'm interested on how South Korea do the drive-through check and the check over to 10,000 people. And does Korea use rapid test or PCR? And last question, I think, what is your actually guideline check from suspected locations? And I think maybe also the role of pharmacists in the emergency department in handling the patient as well. Thank you.
Sally, can you share the information regarding the two Stanley questions or any other participant from Korea? Stanley, can you repeat the questions again? Can you repeat questions again? Sorry. So Sally can reply.
Because we're using RT-PCR, and it's the testing method most of the countries are already using, and it takes about 5 to 6 hours, and the payment is supported by the government.
Is that clear for you, Stanley? Any more to discuss?
I think it's enough. Thank you very much. It's such a good explanations. Thank you.
I also saw the question on how we update the cases every day. As I mentioned during my comments, we update the number of patients twice a day, once in the morning and once in the afternoon. And we also update it by social media and press release.
Thank you, Sally. All right. Unfortunately, now we are running out of the time, and our online forum has lasted longer than 1.5 hours already. It's very interactive and productive here to see all the comments and all participants from the Southeast Asia who joined here together tonight. So at the end of this forum, I would like to give the floor to Audrey to share our final remark from AYPG.
In a separate time. So we will also answer through Facebook, and also you can also email us. However, we are thankful for all the speakers as well to share all the updates, and also we learn a lot about how to combat this disease. And we believe by learning from each other, we can combat this disease together, and we can overcome the situations. So taking from all the discussion today, from AYPG, we learn some important issues here. So we realize that we as pharmacists play a significant role in COVID-19 prevention and in controlling and reducing the damage that may occur to the public health due to this outbreak. So as YPG, of course, we can recommend young pharmacists to reinforce the FAPA guidance on community pharmacy practice and FIP health advisory, and to take lead in the implementation in their workplace. Young pharmacists should also become reliable and should also become the source of information that is reliable and scientific. And also, we need to strengthen regional knowledge sharing amongst AYPG on public health strategies and on pharmacists' role in combating COVID-19. Explore effective regional communications platform as well. And lastly, encourage local YPGs, national YPGs, to write to their local health authority on proposal to enhance pharmacists' role and public health strategies, where it was found to be effective in other countries in the regions. So also we need to emphasize on the importance of transparency and honesty in combating this disease. I hope that together as young pharmacists in the region, we can play our roles, significant roles, and also improve the health system in our own country. Thank you, everyone. And I hope we learn from each other again and encourage each other to do our best in fighting this disease. Thank you.
Yeah, thank you, Audrey, and thank you, everyone. And I think it's time to say good night for tonight. Maybe too early, but yeah, stay safe and healthy. Take care of yourself and your families. And I hope this online forum is useful for you and your community. See you again next time. Bye bye.